Warm welcome to today's talk. Now, I've been getting lots of questions about long COVID, people that are symptomatic for a longer period of time than normal. And this is particularly important at the moment because we're going into a significant second wave. Cases are increasing dramatically in Europe and in the United States. For example, I was just talking to someone in the Czech Republic this morning in Europe, representing Europe to some extent. And for every 100 tests that are being done there at the moment, 30 are coming back positive, indicating there's a lot of community transmission, meaning there's going to be a lot of people getting sick, there's going to be a lot more cases. And some of those cases are going to go on for a longer period of time. There's going to be sequelae after the initial condition. Now, if you don't want to watch this video, I'm just going to give you a few bottom line figures, then you can scoot off if you want to. So most people who are symptomatic are better after about 10 days. 10 or 11 days, most people are back to normal duties. But 1 in 7 have symptoms for at least 4 weeks. And the longer symptoms are primarily extreme fatigue and headache. So 1 in 7 at least 4 weeks, 1 in 20 it lasts for 8 weeks, and 1 in 50 people it's lasting for 12 weeks, 3 months or more. And while this data I'm going to give you today doesn't mention it in detail, I've personally talked to quite a few people that have been symptomatic for 6 months or more now. So quite what that proportion is we don't know yet, but we do know 1 in 50 symptomatic for at least 12 weeks, so it's quite a long time. Now, what else do we know about the risks for this? Well, we know that age is a factor. Older people are more likely to get what we now call long COVID, sometimes called long haulers. People with increased body mass index have an increased risk, and females, particularly middle-aged women, have a slightly higher risk than men. Not dramatically, but it is a slightly higher risk. So these things can be used to predict the likelihood of long COVID developing. But the most important one, well, now actually age is the most important one, but after that, it's the symptoms that people have in the first week of the illness turn out to be very predictive. And the COVID symptom tracker people are putting all this on an app. So within the next week or so, this should all be in place. You just put in your symptoms, flick your thumb a few times on the app, and it will tell you what your risks of having COVID at particular stages are after 4 weeks, after 8 weeks, after 12 weeks. And in time, no doubt, the predictions will be more than 12 weeks. But at the moment, they go up to 12 weeks. So that's what this video is about. Straight on to the details now. So this is the headline, 1 in 20 likely to suffer from long COVID. So this is basically saying that people with mild symptoms who are not sick enough to go to hospital can still have long-term symptoms. But hospitalised patients already have recognised long-term problems because they've been sicker. And you would expect this, particularly shortness of breath and particularly fatigue. But what this is saying is that people who've even had milder symptoms still have a fair level of risk for this longer term COVID, primarily fatigue and headache, but as we'll see, other possible clinical features as well. Now, COVID symptom tracker app people, there's over 4 million of them, but this is a group of just over 4,182. And these are people who have used the COVID symptom tracker app regularly. So they've logged their data consistently and conscientiously, and also have been definitively diagnosed on swab PCR testing. So we know these people definitely have COVID-19, and we know that they have logged all their symptoms conscientiously. So they're definitively diagnosed. And 4,182 is a good sample size. You can get a lot of good statistics from that. So as you would expect with a COVID symptom tracker app, fairly rigorous data analysis and data collection. Now, how to predict COVID-19? So obviously symptoms, age, male, female, body mass index, comorbidities or factors, and these can accurately predict the development of long-term symptoms, particularly relating to age and the symptoms that someone experienced in the first week of illness. This has turned out to be these are the two key predictors. So the scope of the problem, 11 days or less, so 10 days illness basically. Most people back to normal duties, good. Symptoms lasting for at least 4 weeks, 1 in 7. That was a total of 558 of the over 4,000 users. Turned out to be 13.3% of that sample. Now, because the sample of the COVID Symptom Tracker app users and the ones that were tested is not completely representative of the whole population, mostly from the UK, but not entirely, they've extrapolated that to the whole population and worked out it would be 14.5% of symptomatic people still having symptoms after 4 weeks. So this is just a correction because this sample is not totally representative. That would be the figure for the whole population. Staying ill for 8 weeks, 1 in 20, 189 out of the 4,000 odd. That's 4.5% of the app users, and that transpires at 5.1% of the population as a whole. Staying ill for 8 weeks. So given the large numbers that we're having now, we can see that this is a lot of people are going to be well under par, and in some cases really quite poorly for some time. Suffering for longer than 12 weeks, 2.3%, 1 in 50, works out at 2.2% of the population as a whole. So again, quite a significant number really, and so far the data does not extend beyond 12 weeks. But as I said in the bottom line introduction, I've personally talked to a lot of people who've been ill for many months now. And this is running into the many thousands in the UK. So who is most likely to get long COVID or be a long hauler? Now, age is the strongest predictor. Older people more likely than younger people. Not too much of a surprise there, but it does occur in all ages. Now, of people aged 18 to 49 who are symptomatic, up to 10% can have it for a longer period of time. 22% over the age of 70. So we see that over the age of 70, it's more than double the amount of people having longer term symptoms than the younger age group. So age is the strongest predictor. Now, symptoms were the second predictor. And people who had many different symptoms in the first week, so more different symptoms in the first week, 16.3% who had a variety of symptoms in the first week, 5 or more symptoms in the first week in fact, went on to develop long-term COVID. And for 5 or more symptoms, people that had 5 or more symptoms in the first week, what we call the odds ratio, basically there are 3.95, almost 4 times more likely to develop COVID-19 than those who'd had only 1 or 2 symptoms. So people developing 5 symptoms. And they're able to break these down. The 5 symptoms that we're looking at mostly were people with undue fatigue, 2.83 times more likely to get long COVID than people without undue fatigue. People with headache, 2.62% more likely to get it than people without significant headache. Dyspnoea, difficulty breathing, 2.6% more likely. Hoarse voice, 2.3% is a risk factor. And the myalgia, the achy muscles, 2.2% more likely than people without that symptom. So what we see is particular symptoms here are associated with an increased risk of long COVID that has been quantified as we've seen. But people that have 5 symptoms altogether have a greater risk than people with individual symptoms. And this is all related to the symptoms in the first week of the illness. So this is the key thing to get here. The symptoms in the first week of the illness are predictive for how likely long COVID is to develop. Interesting things that you can get from all this data. Now, symptoms, people aged over 70. Now, in those over 70, loss of smell was the most common predictor. Now, loss of smell, this anosmia, we know this is more common in young people. So actually the proportion of people over the age of 70 that get the anosmia isn't very high. But if people over the age of 70 do get the anosmia, then they've got a 7.35 greater chance, more than 7 times chance of getting long-term COVID. Same with fever in the over 70s, they're 5.5 times more likely to develop long-term COVID if they had fever, and people with hoarse voice over the age of 70. So much greater risk there in people over the age of 70. But strange that the anosmia is not a big predictor for people under the age of actually there's not a cut-off age, but for younger people it's less likely to be predictive of long COVID, but in older people it is likely to be predictive of long COVID. So there we go. So age was the main factor. Now the third predictor was body mass index. So that was a significant one. That was also a predictor. So first of all it's the age, then it's the symptoms is the second predictor. Third predictor is the body mass index. Higher average body mass index associated with greater risk. Male, female. Now, of course, we know that men are more prone to be readmitted to hospital in the acute disease, but women are slightly more likely to suffer from long-term COVID. So men we know are much more likely to die in most age groups, more likely to be hospitalised, but women are more likely to develop long-term COVID. And the proportion there was long-term symptoms in 9.5% of men, but 14.5% of women. So there's a fair difference there. Now, the other thing that you would expect as a predictor is comorbidities. So, of course, this was looked at. And it was a bit strange. The only comorbidity that's a predictor of long-term COVID is asthma. That was the only one. So people with asthma, more likely to get long-term COVID. No particular increased risk ratio was put on that, but they do have an increased risk. But there was no clear underlying links to other health conditions. Bit surprising. So people with chronic obstructive pulmonary disease like chronic bronchitis, emphysema, chronic heart disease, diabetes, all of those things do not seem to have an increased risk for long COVID. The only comorbidity identified as an increased risk factor was asthma. Now, the long-term COVID symptoms themselves fell into two broad groups. Group 1, dominated by respiratory symptoms, cough, shortness of breath, and fatigue and headaches is a major feature as well, of course. So that was kind of the first groupings, respiratory and fatigue. But there's another group of people that report different long-term symptoms. And this group 2 is called the multi-system group. So the first group, it's respiratory symptoms, fatigue and headache, which is kind of what you would expect really. But then you have this other group that's a bit strange. And a significant size group it is. And it's called the multi-system group, where the long-term effects can affect many parts of the body like the brain, the gastrointestinal tract and the heart. Palpitations and fast heartbeats are common. We've interviewed people on this channel who get very, very fast heart rate just walking up the stairs. Basically, they can't do things because they get this very fast heartbeat, this tachycardia. And the palpitations mean you can feel your heart beating. Now, when you can feel your heart beating in your chest, that can be caused by increased the heart beating harder or beating quicker, or if it's beating irregularly. If there's what we call a dysrhythmia, that some people call arrhythmias, that can give you this subjective feeling of feeling your heart beating, palpitations. You'll know you've had this after exercise, or if you're anxious, you'll have had it yourself. Now, this multi-system group also complain of pins and needles and numbness in different parts of the body. And problems concentrating, this is called brain fog, that you just can't think clearly. A very, very unpleasant symptom. it can almost cause what you call a derealization, where you kind of feel like you're not living in the reality of the situation. And they also did notice that people who experienced a wide range of symptoms across many body systems were more likely to need a hospital assessment for their long COVID. So, in other words, this multi-system group were more likely to need a hospital assessment than people in this group 1 respiratory fatigue group. And that's not surprising because, of course, if people are complaining of cardiac symptoms then, or neurological symptoms or gastrointestinal symptoms, these are things that we should check out and diagnose as much as possible. Now, people with long COVID, recurring symptoms, 16% got recurring symptoms of the initial disease. But having said that, that does occur in people who don't have long COVID with short COVID, 8.4%. So, but it was double, return to symptoms of the original disease. It doesn't say in this study, but presumably the people with short COVID had these recurring symptoms for shorter periods of time than the people with the long COVID, but that's not specified. So predicting who will get long COVID. Now, the model that they've developed on the COVID Symptom Tracker app is able to identify 69% of people who went on to get long COVID. In other words, the model is 69% sensitive. But of course, there's also the possibility that it could give false positives. So the model was 70.3% effective in avoiding false alarms. In other words, there was a 27% false positive rate. So false positive is quite good at predicting, predicts pretty well 7 out of 10 people that can develop it, but there's also the 27% chance of false positives. So the predictive model was 73% specific. But having said that, this is the first time this has been done, and as more data is collected, you would expect this to become more accurate. But that's where we're at the moment, just based on information about people's comorbidities, age, male, female, body mass index, as long as they accurately report this. Symptoms, these predictions can be made, and these will get more accurate with time. Now, they did check this data with an independent data set of 2,475 people who were tested with antibodies. So the initial data was collected by this number here, this 4,182 tested with symptoms and antibody testing, but could it have been there was something strange about this group? Now, for the size of the group, it would be very surprising if that was. But they've had another group of 2,475 people who'd also reported their symptoms conscientiously, but who had been diagnosed with antibody testing. In other words, they'd been diagnosed after the event, and they found out that the model did work for them, that the evaluation of the symptoms and the risk factors in these people was the same, indicating this is an accurate model as developed so far. So the app will give the probability if you fill it in correctly, and this can help target interventions and research, because basically we don't know what's going on here. It does point out that this is a poorly understood phenomena, this long COVID phenomena. And as we say, there are many thousands, in fact probably in the UK roughly 30,000 people already who've had symptoms for much longer than this. So to what scale is this going to cause a chronic health problem? We don't know the answer to that yet, but we do know that these proportions of people are going to be sick for 4 weeks, 8 weeks, 12 weeks. So just a quick couple of quotes from the experts. This is one of the experts involved in the King's College data analysis. It's important we use the knowledge we've gained from the first wave of the pandemic to reduce the long-term impact of the second wave. But of course we are collecting more data now that we are in what we are now calling the second wave. Thanks to the diligent logging of our contributors, this all depends on people giving the data, this research could already pave the way for preventative and treatment strategies to reduce long-term effects. So anything we can do to reduce future problems, of course we want. And then a bit of a plug for the app. Of course, using the app daily can help affected people and their doctors better categorise and judge their risk development for longer term, more severe disease. So even just filling out the app now, the app will be giving predictive information, which is always useful. Pre-warned is pre-armed. We urge everyone to join the effort by downloading and sharing the app, of course, which we've advocated for many times. And of course, Tim Spector, he's the big cheese in the COVID Symptom Tracker app. He chips in. COVID-19 is a mild illness for many. And remember, 20% are asymptomatic, so let's not get this out of proportion. It's a mild illness for many. But for over 1 in 50 people, symptoms can persist for 12 weeks or longer. 3 months is a long time to be under the weather. And for some people, it's going to be longer than that. So it's important that as well as worrying about excess deaths, we need to consider those who will be affected by long COVID. We do tend to focus on the deaths, but the long-term morbidity is also important if we don't get the pandemic under control soon. Having such large numbers of people affected means special services need to be set up urgently with a full financial help for hospitals and GPs. In other words, we need health care provision to diagnose and help people with longer term illness, to cure it if possible. As we wait for a vaccine, it's vital we learn to work together to stem the speed of coronavirus via lifestyle changes, rigorous self-isolation symptoms, testing of positive people. We need to slow down this, as we've looked at many times. So that's all I wanted to say about that. The significant problem of long COVID, and that quantifies it really quite nicely. I just want to finish by really differentiating between the chronic and the acute. So an acute illness, acute by definition means of recent onset. So if you've just become symptomatic in the last week or so, that is an acute illness. But if you've been symptomatic for a long time, that's becoming a chronic illness. So let's just review briefly now. We've reviewed the risk factors for long-term COVID. Let's just briefly remind ourselves, we've done this before, but we'll have a quick look of the risk factors for increasingly ill people in the acute situation. So risk factors for severe COVID-19. Age, of course, is the main factor, but this is not including age. So these are the risk factors as well as age for being severely ill in the acute stage. Not necessarily meaning you'll get long COVID, but good to know that these people are more at risk for acute severe illness. So obesity, chronic kidney disease, chronic obstructive pulmonary disease, immunocompromised state due to solid organ transplantation. This is people that are on immunosuppressive therapy, of course. Their immune systems are suppressed. Quite a few types of serious heart disease, heart failure, coronary artery disease, cardiomyopathies. That is disease of the heart muscle. Myo is the heart muscle. Pathy disease of. Sickle cell disease, which is genetic. Type 1 and type 2 diabetes. So they're pretty well known. I think we can put those in the known categories for risk factors for more severe illness. And these ones the data's not clear on these yet. Asthma, we've seen it is a risk factor for long-term COVID, but we're not quite so sure about people with asthma in acute illness, because this is under the may represent illness. And this is from this is from Medscape, so click on there for yourself. I'm surprised. I would have thought we were more sure about asthma, but this is what it's saying. They're saying they're still unsure whether they're still saying asthma may represent an increased risk. Cerebrovascular disease, poor circulation to the brain. Cystic fibrosis, again, you would think that was definitely a risk, but in cystic fibrosis you get thick secretions in the pancreas and the lungs, basically. It's genetic. Immunocompromised patients, neurological conditions, e.g. dementia, liver disease, pregnancy, pulmonary fibrosis is where scar tissue develops in the lung, smoking and thalassemia is a genetic disease affecting the structure of the hemoglobin molecule. So they're the risk factors for more acute severe disease, and the first 3/4 of the video we looked at these risk factors for longer term COVID. So there's no question that we are going to get some people with longer term COVID. How many people that's going to be beyond the 6 weeks, we don't know. With more data, the models will get more accurate and predictive. Whether there's going to be still people suffering from the fact that they've had COVID in 2020 and in the years to come, we really don't know yet. There could be a small proportion, but we really don't know yet. But we do know these figures for a significant number of people are going to be ill for 4 weeks, 8 weeks, and 12 weeks and beyond. So that's all I've got on that. That's the up-to-date information on that. Read those references if you want a little more. But basically that is a summary of where we are at in our understanding of long COVID, or so-called long haulers, at the end of October 2020. So thank you for watching as always.